it's now very, very common to take 1-2 research years, do 1-2 surgery prelim years.
Are you talking after medical school?
Mm-hmm.
Really? Wow. That's crazy.
Because it's gotten so competitive.
Welcome back to the Hefflinger Podcast. Today we have the pleasure to have Andy Nguyen here with us. He's been a creator on YouTube for several years, and he's currently a PGY1 resident at Yale for anesthesiology. And we're super excited to get to talk with him about how residency's going and kind of how his journey of creating during medical school and kind of posting content on social media went. So yeah, thanks for joining us tonight.
Thank you both for having me. It's a great time it's a great way of spending my one day off during the week. And like I said before we started recording, just being a part of any sort of creative process, particularly for those in medicine, always just relights my fire. And so thank you so much for reaching out and for having me be a part of this.
I have to tell you, Andy, so when I was doing my ranking, so I interviewed like in 9 neurosurgery programs, and I interviewed at Yale. I'd never been there before, and I think I ranked like U of M and then Johns Hopkins, University of Rochester, where I ended up going, and then I had like Seattle with Dick Nguyen, and then Georgetown, and then Yale. I ranked like 6th, I think. But I think Spencer was the chairman of neurosurgery at that time, probably a long time ago. Do you recognize that name at all?
Oh no, I'm still kind of getting my feet wet. It's very interesting as an anesthesia intern, as I'm sure you've seen.
Well, I love the campus. It was just gorgeous and everything about it.
It is so beautiful. And I wish I got more time to spend outside to see it.
Really.
Yeah.
But it is definitely a weird experience for any anesthesia intern. Thankfully, I matched categorical, meaning I am doing my full intern year at the same institution that I'm going to be doing my CA years or my anesthesia years at. For some people, they do like a transition year or something at a different program, then join as a PGY2 to do their anesthesia. But because of that, I'm kind of tossed amongst all the different services.
So why don't you tell people, like, people ask me, like, when you start out nursery, they don't realize you do a year of internship. So maybe for people out there, they'd be interested to hear, what is your internship, your first year of anesthesia? It's not like you're an anesthesiologist in surgery all the time. So why don't you tell people about your rotations? I'd be interested to see what you do for your first year.
Oh my goodness. So it's funny you mentioned this, because a YouTube video about exactly this is going to go live 2 days after the recording of this video.
We'll link it in here.
But yeah, so I actually have it broken down here. It depends on the program. And some programs kind of weigh medicine versus surgery a lot more. And then some programs do a lot more anesthesia. I was just talking to some of my co-interns that I believe UC Irvine. I have a couple friends there. They do 6 months of anesthesia as an intern there, which is incredible. But for the majority of people going into anesthesia, their first year looks almost 50-50 split medicine and surgery. For us, it's a little bit more skewed towards the medicine side and critical care side, which I do think is for the better. Overall, it's 2 months of surgery, 2 months of general medicine, so internal medicine wards, 2 months of critical care, 1 month of emergency medicine, 1 month of outpatient clinic, 1 month of point of care ultrasound, 1 month of being in the internal medicine.
Point of care ultrasound, wow.
Point of care ultrasound, which is something that I was
specific.
It's something I was very passionate about in medical school, and actually helps lead some of the curriculum there. So having that be so important here was something that drew me to Yale.
Yeah, really.
And then 1 month of anesthesia, 1 month of vacation. So I think what will be very, evident in what I just said is it's just 1 month of anesthesia.
Yeah.
Which
and you're not going to take your vacation, are you?
Oh, I will. I will take it with me.
I thought you would give that month back and do an extra month of anesthesia or something.
Yeah, I think we'll have plenty.
Plenty to do. I think would be interesting is, there's the transition from undergraduate to medical school. And we were talking a little bit about before, kind of you did a combined track of 7 years. But then what's the difference, or have you noticed, from transitioning from medical school to residency? And how is that like adjustment? Because it's been 6-7 months now, right?
Yes, it has. And then I think, oh man, it is so much steeper than undergrad to medical school. And I think if you ask any resident that, they'll probably say the same. It's a job. You're working. You're expected to show up and be there for people. And by people being your patients, but also people being your coworkers, your co-residents. There are people who are counting on you to be there on time for sign out. There are people counting on you to make sure your notes and your handoffs are complete so that they can best take care of people when you take over their patients and cover them overnight. And then not just that, but you are, for probably the first time ever, being called to make very important decisions by yourself. Yeah. And although good programs, Yale included, will set it up where you have this illusion that you are by yourself, but you never actually are. If you need help, you do have the support there, but you have the space enough to go, okay, they're calling you as the covering provider. What decision do you want to make? If that entails you talking it out with somebody, then sure, absolutely do that. But at the end of the day, it's your decision. Whereas in medical school, I mean, you can spit off all the studies and papers that support your decision, but at the end of the day, the decision is not yours. And
when was your medicine rotation?
Which ones?
Your medicine rotation. What are you already through those?
I have one more left, but it's all been just general medicine. One was specifically kind of a nephrology floor, and then another one was medical oncology, which that was one of the more difficult rotations, both like on just a mental level and also an emotional level for me.
And when people are dying and you get called, are you running the codes then? Like who's running the codes, or is it a senior resident, or is it you?
So when you're called to these emergency situations, the ICU team on call is typically the code team. But of course, you as the primary team would be the first ones there. The code team will come in as support. So your seniors would be the ones to run the code. And then the ICU team will come in and the fellow will either give kind of whisper in the ear support or additional manpower if needed. I think that's typically the first 6 months of intern year. I think now I'm saying this very much with recency bias. I've seen enough codes and been involved in enough codes to at least, if needed to, I would feel comfortable starting the initial resuscitation. And even if it's as simple as somebody, and you'll get this very often, someone's down, unresponsive, you're the first one that gets there. And any of the nursing personnel or something going like, I don't know what happened. And even if you have the mindset of, can you please check a pulse and let's get pads on so we can evaluate a rhythm, that already is something that as a fresh intern, you would just not have been comfortable with or not even know to say. And by now, like, I know where we are in codes, I know what to get. And even if there are a lot of people in the room, okay, we already have a timer. We got someone on meds. It's been the first round and they're struggling to find pulses. Okay, I am like point of care ultrasound credentialed. Let me get the nearest ultrasound so I can evaluate for either pulses or cardiac movement when they can't feel it, as other people are getting the Lucas, everything. So it is a lot of
the Lucas. Is that automatic chest compression thing? Okay. All
right. And so you just learn as time goes that even if you aren't the one leading it, that doesn't mean that there's not a task or a role that you can fulfill that will be very, very helpful in the resuscitation of this patient. And I think every intern has those stories of
what what kind of hours are you putting in? I know when I was an intern, we were up all night. When we were on call, we were up all night, and it's nonstop. The nurse is calling you this, that, come and check this patient, chest pain, low blood pressure. I mean, is that your experience?
It hasn't changed too much. I think your hours, especially as a surgical resident, are probably much more lengthy than mine. As in your medicine rotations, it is guaranteed 12-hour days. And then my surgery time is exactly like that. It's I had multiple 28 to 30-hour days of, you get sign out from the night team at 5:30 in the morning. You go through your entire day, and then you are the cross cover intern covering. I mean, for me, on one of my surgery rotations, I was on my surgical oncology, but then I was also cross covering the primaries for thoracic, endocrine, and breast. And then when I was on vascular surgery, I was cross covering for all the vascular patients and the cardiac patients. And so, yeah, it's the same thing.
So you must have had 6 pagers. The most I ever had was 3 pagers on my belt at one time, which was insane. It's nauseating. Did you really? Yeah. I don't miss those days.
So we were talking a little bit too before we started recording, but I'd love to kind of talk about. You said in high school you had kind of been pretty creative. You had been doing videography and photography already, and you had done that even professionally for a bit before going into undergraduate for college or medical school. And I'd love to kind of talk about that journey and then kind of meshing that with creating and being in medicine and kind of that overlap, and then go from there. Be very interesting.
Sure. And that's something that I think a lot of my time in medical school and even now as a resident, I'm a huge advocate for. Everyone has their artistic medium. Mine just happens to be photography, videography. Started back in high school, and I was the student body president, student section leader, all that, grandeur that just does not matter at all in the scheme of things. But as part of those roles, I learned to pick up a camera. It's my dad's old Canon Rebel T1i. Didn't even have autofocus on it. But I started taking pictures of events and capturing the moments of the football games, pep rallies, and then I started doing photography for my local Red Cross, running those pages. Throughout college, I evolved to learn the video side of things, running media stuff for my regional college ministry, still help with the Red Cross. And then with all these college organizations, I was like heading up all their media stuff. And I will definitely say that my specialty is for photos, either event or portrait photography. And then for videos, it'd be documentary or interview videography. And I say all that to showcase that there is this central theme that I fell in love with, which was, how can I highlight a story and capture emotions and translate that across, whether that be social media now or whatever platform, to another viewer to feel exactly how they felt. Moving that into medical school, I started my channel as, like many people do, their little COVID project. But because of that, the typical socials and gatherings that I would have experienced as a first-year medical student weren't there.
Yeah.
Our med school class at its start became very isolated. We had no way of learning about each other. And I remember reaching out to a few of my classmates saying like, hey, I'm starting this kind of channel. I would love for you to share your stories in like an interview format and, just talk about your emotions and feelings before starting medical school. Like this is for a lot of people, a culmination of a lot of hard work, blood, sweat, and tears, and support from family and friends. So what are you feeling right now? And that went out, and my class loved it because it was this one little way that even though we weren't able to be in person with each other, through this medium, we were able to share each other's stories and connect and find some sort of semblance of community.
Yeah.
And from there, of course, the vlogs and stuff are really cool, but I really do think that my initial love is doing these interviews. And also my med school class trialed, well, we were the guinea pig class for a 18-month what's the math here? 18-month preclinical curriculum. So they were cutting it down to just 18 months before you go into your core clinical rotations. And then with that in mind, I had this sensation of being rushed. A lot of my classmates had this sensation of being rushed, where you do all that, you do your core rotations, then you have like 3 months to take step 1, step 2, and all your shelves.
Mm-hmm.
But we give the advice all the time for these competitive specialties, neurosurgery being one of them, and like, just don't worry about it right now. Feel it out. Where you decide that's what you want to do is your clinical rotations. But on this schedule, say you had surgery on your last rotation, you fall in love with neurosurgery. All of a sudden, now you have 3 months to get your scores right, a few more months to apply for your OAs and sub-internships, and then ERAS is submitted. And for those competitive specialties, without you practically walking into medical school knowing that you wanted to go there, it's really, really hard to be a competitive applicant, especially now in the match climate, to basically match in 4 years.
Mm-hmm.
It's now very, very common to take 1, 2 research years, do 1, 2 surgery prelim years.
Are you talking after medical school?
Mm-hmm.
Really? Wow, that's crazy.
Because it's gotten so competitive, and knowing that was how my med school was about to be structured. And at the time, none of us could have shadowed. It's still COVID. We weren't allowed in the hospital. And so I was like, how can I figure out a way to safely, but also very authentically showcase different specialties, not just for the educational pathway that it takes to get there, but also what is the personalities that are gravitated towards each specialty? Because I do fully believe at the end of the day, it's a big personality match. And we joke time and time again, Dr. Glaucomflecken is a big proponent of the specialty stereotypes. And in some ways they're rooted
it's definitely true.
Right. It's rooted in a little bit of truth. And I was watching kind of these Vogue Send Me Through Question interviews where that's exactly what they did for celebrities. They're bringing the camera and by extension the viewer into the literal homes of movie stars, professional athletes, and showing them like, hey, 1, what's your life like? And 2, what are you like when you're not at work? Basically.
Yeah.
And of course, Vogue has a whole 10+ man crew managing lighting, audio, camera work, everything like that. I was like, how can I jerry rig a 1-man setup of this? Ended up coming up with something. And then I reached out to one of my longtime mentors who's known me since I was 5 years old. He was one of the best pediatric emergency medicine faculty at my medical school. He was the one who introduced me to medicine and who I modeled my platonic ideal of a physician to be, because whenever my friends would get a splinter, hurt their arm or something, even on the Boy Scout camping trips, who was the first one called? Him. And he would be stitching people up, pulling splinters out. And I was like, okay, 1, to do that at any time is incredible. And 2, I think his heart for children in particular entirely inspired me to go into medicine. And I wanted to be pediatric emergency medicine for a while. I wanted to do pediatric anesthesia. That in itself is a whole long track. All that to say, I couldn't have think of any better person to be a very patient and also, I think, archetype person of what that interview series was supposed to be. He was the first one. And sure, it was rough at the edges, but that video still holds a very special place in my heart because of what it started. And then after that, I started reaching out to residents, faculty at my medical school, and just kept doing it because it was a way for me to learn about the different specialties when I couldn't, at least in a clinical environment, and then also bring people along to learn with me. And it was so much fun. And then, eventually I started asking other people on the who were, prominent on the platform of, hey, do you want to be part of this? And Dr. Cellini was the first one who said, hey, I'm from Georgia. I was a University of Georgia swimmer. And in fact, I was born at the Medical College of Georgia, for where I went to med school. It's like,
wow,
let's figure out a way to support you flying up to New York to do this interview. And that was the first time it felt like, oh, wow, okay, this is kind of cool. This is getting somewhere.
Yeah.
And I did that video. It was incredible. And that was the first time I also kind of talked shop about YouTube and got some really fine-tuned advice on what it meant to build up a platform on particularly YouTube. And from there, I started implementing a lot of the advice he gave me. Then I was like, oh, this guy's big on YouTube. I'm going to post this video and it's going to go viral. And all of a sudden my channel's going to take off.
Yeah.
I posted it. It did okay. It did well. And it was like 2 or 3 weeks after, I remember the day of waking up and looking at my analytics and seeing a straight line in the views and wondering, why do I have 200,000 views in the past 24 hours? What happened?
Wow.
And this is going to be very poetic. An interview I posted nearly 2 months ago, all of a sudden, just to this day, I don't know why, went viral. And that just so happened to be my 73 question interview with an anesthesiologist.
Oh, that's awesome.
And I think that kind of sparked the ability to do more of these. It was something that I love doing, and then something that a lot of people love to watch.
Yeah.
And it showed me the positive potential of what social media could be. I think one of the most, I'm going to say, unexpected blessings of what YouTube, and I think finding out the positive impact social media can have, was I truly do have lifelong friends that I've met only because of social media and this platform. I have mentors who are doing incredible things, both on a creative career as well as a medical career and even a business career, because I sent an email saying, I value your story and I want that story shared with my audience. Would you want to do it?
Oh,
and
cool.
them saying yes.
Yeah.
And like, I'm going to be one of my best friends, Rachel Southard, who is an OBGYN resident out in California. She was on YouTube and doing vlogs long before any of us were. And on a whim, I was in LA for the first time doing one of my interviews with a DMP. And I just said, hey, you want to meet up? And she said, I was nowhere even near the amount of following she had at the time. It's like, yes, I've watched your stuff. I love it.
Yeah.
And literally, I'm going to be at her wedding in a year.
Yeah.
And it's those little connections. Like, I had one of my best friends. I don't know if I can say this yet. I don't know if he's going to announce it, but he texted me a ultrasound of his kid on the way. And these are people that I've met in person probably only a handful of times. Yet, because of this very sincere connection that social media has brought and what YouTube has done for me in my life, I feel so integrated into others' lives, enough for people to share these huge life events.
Yeah.
And I want to note something about particularly the medical creator community. I saw you recently did a video with Paul Tran.
Yeah. That's the one, Dad, about the match day.
Yeah, the match day. Yeah.
Mm-hmm.
Yeah. He just posted it, I think, yesterday. On the day we're recording, he's posted it yesterday.
He is one of the most genuine people ever. And we talked. I also interviewed him on my channel for Pediatric GI, but off camera, we talked very sincerely about what potential social media has to reach. I mean, people you would never would have in your entire life. I'm gonna try to put this. I'm gonna put this in a really nice way. The difference between the medical creator community and just the general creator community period is if all of this goes up in flames, if one day our accounts get deleted, or we stop posting, or the numbers disappear, they find out it's all bots, and then it all goes away.
Yeah.
Guess what? We're still all physicians, all surgeons. And because of that, there is a sense of community that is very, very different compared to so-and-so creators that do this full time. And I personally just hearing the word medfluencer or influencer makes me want to physically throw up.
Yeah.
I think one, because it distills, for me, I have a professional background in photography, videography. It distills what I do to playing into an algorithm and less of like an art form, which is where I come from. There are definitely many people that do fit more in that category of like, hey, how can I get the views and everything and curate these things? But I think because nobody is doing this full time, there's no sense of, hey, I'm doing this for you, or we're going to collaborate, and therefore something else should come in return.
Quid pro quo, yeah.
Right. And it's healthy. That's how it should be, but it doesn't happen that way when your livelihood is on the line, doing collaborations. And in the medical field, you see a lot of very healthy partnerships and collaborations because we all know that this is something we're doing for fun, for an outreach, looking to impact people, not influence people. And you can tell who is on that mission and who's not. There are many physicians who have left medicine because they want to pursue that full time. Yeah. And they have their reasons, absolutely. I just think while people are in that community as medical professionals and creators, there's an openness to be collaborative that feels without strings attached.
Yeah, I mean, we could talk. My dad and I talk about this all the time, and it's awesome to you see other people's content and then talking to them. There's a lot of people. It's all about being very genuine. There's a lot of people that you can easily get stuck in the race of trying to optimize everything or just doing trends to get views and other stuff. We've always been I think for us, it's very important. There's all this other content on there. Why not have like actual experts sharing good knowledge on things? And you can do it in tasteful ways. It's really cool to do collaborations. But yeah, it's what I don't like, and this is just social media in general, is even in the medical space now, like you said, medical influencer. I know we hate that term too because it's different, but there's a lot of people, they're just not really showing the realism of being a doctor necessarily anymore with their kind of vlog style stuff or what they're posting on their Instagram stories and everything else. It's like, I think you should more disclaim. They almost keep the medical title because that's their entire content and brands around. And this happens in all parts of social media, I think. But I think it's important, and it's just like normal social media with people posting most of the positive things versus the negatives. I think it's important not to it's important to show people what's it actually like if you're going to be because the majority of people watching it, they're interested in becoming doctors or physicians or nurses. Like it's good to get that realism. And I think it gets away from that at times.
Well, I think some people just want to be celebrities too. And they like, if I ever get to the point they have to dream up stuff to put out there, it's like, if it's got to be that fake just to get views, what's the point of it? You know?
Yeah.
Well, I think this is a good transition to where I am in particular with the creative space as a resident. We started off this talk talking about hours and the different rotations you're on. I think that transition from medical school to residency is tough because you have those responsibilities and you have those hours. And if I'm being quite honest, my days get repetitive.
Mm-hmm.
My days get boring. And I struggle because even though I do have the background to make things look good, I think it would be a disservice to those watching for me to act like everything is okay and everything is fine all the time. There are days where I come home and the best I can do is have my first meal of the day and go to sleep so that I can do it all over again.
Yeah.
And who wants to watch that? Who wants like what is?
Well, they would a little bit, but not over and over.
I think though, right. I even tell my dad, he just did a video the other day about the first time, like his first trauma when he was in medical school, right? Dad, it was medical school.
Yeah.
And just that transition of, the normal world, except like first responders and medical people, and obviously if you're in the military, are just kind of desensitized to trauma and other things. You don't have to deal with it very much. It's kind of just elsewhere. Then you're thrust into that. I do think, that's very hard. And people do like, once you can establish stuff, and obviously a lot of the algorithms have changed now where it's more interest-based graphs, like TikTok now, where if it connects to the right people, there are people I think that are very interested in like the actual genuine stuff like that doesn't seem like it's anything special, versus obviously other things can go a lot more viral. But I think there's always a purpose, and there's different people that will reach that'll be good. But another point would be, like, I'll talk to my dad sometimes, being a medical and being someone who makes content medically related. If you do educational stuff, you're already capping, no matter what, the amount of reach and followers you're going to have, because there's so many people. I tell my dad this all the time, is that just do not go on social media to learn anything. If it's not like music and dance and stuff, they're not going to watch it. So you're just never going to have the same thing, but you don't have to. And I think even with our podcast, like very small, it's not nearly as big as our like short form content. But even if no one listens to this, when we get to reach out to cool people doing cool things and have conversations with it, that's valuable, even if no one listens, in and of itself, and fun. And then if you can do just other collaborations in general, it just opens up such a huge possibility in the world versus just who you can kind of communicate with locally in person.
Absolutely agree. I think that's what social media is supposed to be. It is meant to connect people from all around the world in ways that you never would have before. I just, there is a little bit of a responsibility that I feel. I was taught by a lot of my mentors when doing the whole social media thing throughout med school is your word, knowing that you are about to and now have an MD next to your name, that means your word weighs 10 times heavier than anybody else's.
Yeah.
So use that responsibility wisely. And I think that puts a lot of pressure on people to steward their presence well. I will say I am at kind of a liberating position where, as an anesthesiologist, I'm never going to have to fight for patients. I'm never going to have to search for referrals. And, no one's going to request me as their anesthesiologist during their case.
Yeah, that's not completely true. I mean, when my wife had surgery, I requested the anesthesiologist I wanted to. I mean, you'll have friends that want you. And anyways, don't sell yourself short there, buddy.
Well, I think it's a rare, it's a nice.
I got you. But I got you.
More so than probably a lot of my primary care colleagues, and especially a lot of my surgery colleagues, who especially if they have dreams of doing their own private practice, their business is going to stand on the shoulders of referrals. And so everything that you say and put out on there, you got to be careful. And I did reach out to someone who is a creator, who is a second year medical student, who, is doing her thing, and following a lot of trends, making sure that her videos have a lot of repostability, and really pushing this, hey, like, especially as a female in medicine, which I'm all for, like, we can do this. Like, times have changed, and there is still a lot of discrimination that we will fight against today and over the many, many next years to fix. But it was this video basically saying, like, oh, when he doesn't want you, but he wouldn't understand a single thing that you're doing right now. In a sense of, like, empowerment.
Yeah.
I messaged her, I was like, hey, I really don't think you realize what you just said. Because even though your intention was empowerment, that can very easily be misconstrued as, oh, because this person is not in medicine, regardless of you're male or female, you are therefore inferior in intelligence to me.
Yeah.
And will never be able to understand what I do. And, that hurts if it's a friend, a partner. But then what happens when that comes around and your blue collar worker patient now misinterprets your caring advice as a demeaning talk down towards the person?
Yeah.
And that particularly hurts me, because I'm the first physician in my family on both sides. My parents came over from Vietnam, from the Vietnam War. Mom when she was 11, Dad when he was 9. My grandparents left everything to bring families over here. And when my parents were going through school in the American education system, they're both college graduates from over here. My grandparents were those janitors, were those housekeepers. My aunts and uncles were those people that allowed me to be where I am today and have the opportunity to be the first doctor in my family.
Yeah.
And so to have someone with, again, the potential of having that MD next to their name, put this kind of content out there for the sense of virality, is really a bad look for everyone trying to do the right thing.
Well, it's a bad look for doctors, period. That's why, like, I tell Kevin that I'm a neurosurgeon. There's certain things I'm not going to do no matter what other people are doing, because, I have to represent our field as neurosurgeons, and there's certain things that I think we should uphold as doctors.
There's a credibility, credibility
sure.
too. I think it's just across this with so many industries. It's funny. You can have people out there who have no title and say it's in the financial advisory space or in medical, where if you have no title, you can sell all this crap and promote all these, or talk about all these things, and just with no basis. And then, doctors, especially, I think you definitely have a very high, it's not, I think, just personal ethics to share good information and make sure what you're putting out is good. Because like you said, you can hide it behind the mask of other positivity, hide it behind the mask of empowerment. And there's so many issues with that, because your worth as a human I firmly believe is never tied to your occupation, your level of intelligence, how much money you make, or any of those other things. Your worth as a human is tied to the good you put in the world, how you make other people feel, how you treat others. And so it's very important, because there is all the time. That's the dark side about social media. There can be these trends where it's just dunking on people, and the comment sections can get so bad. Even when we put out stuff, like my mom, so we did actually one with my soon to be brother-in-law. It was a neurosurgeon versus a pre-med student. There's just people dunking on him because he's getting like, oh, you didn't understand. We're just trying to do it like an educational way of showing a situation. And people don't really know what a pre-med student is, obviously, because they're like calling him dumb, everything else. And he was annoyed about it. So we said, yeah, we could take it down if you want, or we just won't do another one. But you can try to respond to people. There's just a lot of people that love dunking on other people on social media. So it's a dark side too. There's positives and drawbacks.
Hey, Andy, well, so what, for your social media, like for people watching, what do you think you would want them to know that you stand for on social media? Like what's your niche that you would want people to know you for on social media? Do you have something like that? Or
I think I'm trying to rediscover a niche, but the one lasting impact I want to have is, can I share the stories of others and myself in a way that, one, looks incredible, as like, picturesque as I want it to be, and two, if there is someone out there, and some of the best comments I get, I still remember the orthopedic surgeon interview that I did, is just big old, about your stereotypical spine surgeon as you can get. But African immigrant, just the kindest, nicest person in the entire world, has voices deep, you think it came from the heavens himself. But the comments in there are going, finally, I see someone that looks like me, who has the same background as me, in the field that I'm dreaming of. And this has given me the confidence, or a little bit of motivation, to take the MCAT for the third time, reapply to med school for the second cycle. That's what it's about.
Yeah, absolutely.
If I can put something out there and have someone identify with that story and go, this might be the fire I needed to get past tomorrow or the next month. That's why I still post. And I think residency has 100%, I'm willing to admit, made it very difficult for me to remind myself of that. Because there are a lot of those moments of, hey, I don't know what to film. I'm tired. I come home and like, I'm not filming at work. It's too crazy, and there's patient information everywhere. I didn't come to Yale and to residency to be a YouTuber. I came here to be the best doctor that I could be. But that's not what the content wants, or like the platform wants. And so I'm constantly in this battle of, how do I get back to that storytelling that I wanted to do? How do I continue to seek and share stories?
I want to tie a couple things in here too. So for people who have been listening, it's NDMD on social medias, and the 73 questions with all these different specialties, phenomenal series. I first actually saw your content about 2 to 3 years ago when you did the interview with, I think it was Dr. Martin Radikowski
Radikowski, yes.
Yeah, he's a neurosurgeon, and that was awesome. That was an awesome video, and I was like, okay, how cool? Because there's very little. That's right around the time we started is when that one came out. And I was like, because there wasn't much stuff about neurosurgeons online and other stuff, and just an awesome series. And actually, I've seen some of your recent ones pop up again. That's why I reached out to you, is the vlog style of being in your residency. I think that's awesome. Like thumbnail, I think types of videos like that are cool. It's very genuine, obviously, kind of describing your experience. So it's really cool. And I think that just a cool example from your story is just by doing things like taking that risk, like emailing people like, hey, these people are way bigger than me, or way more following, and it doesn't have to be in social media. It could be in anything. So many people want to help out, or they want to have discussions with people and all these other things. If you email people or try to put yourself in spaces where you're around these positive influences, it always sounds like this, but you're increasing your luck surface area, basically, of just all these cool things you can do. So I think that's what it's all about. And you can apply that in many areas of your life. Like me and my friend will talk about, there's university professors that you can email about these questions, and they just love it. When I was just being in college, just random question. I was in finance or in entrepreneurship. You can just ask them, send these detailed questions, and you have these experts in the field who are now teaching and other stuff. And they love to discuss those things. So there's a lot more potential out there than you think, I think, for people listening when you kind of just put yourself out there and go for it.
Absolutely. What's the ND stand for?
Oh, goodness. So contrary to what some of my comments will say, I am not both a naturopathic doctor and MD. So I keep the name around because when I got into the BSMD program, that was kind of like this weird little ticket to being the first doctor in my family when I was 17. And of course, a lot of my friends were very supportive of it, knowing that it was kind of a very untraditional path from college. And, it was a nickname I got. If you, chop the A off
that's what I was looking at, and take the Y off its ND. Okay.
And just, say my first name like you're 5 years old and your teeth are still coming in.
I see.
That's it.
That's funny.
It's an old nickname that I got from high school, but I keep it around in that channel name because to me, it represents a lot of the blind support that I had from family and friends going on this journey, not knowing what the next step was, but still trusting that it was there. And so as weird as the name may seem, and probably not great for personal branding, it means too much to me to change it.
Yeah. No, I think it's still, once you have that established too, people, it's hard to want to change it. And it's really cool. Yeah. What it represents.
I like listening to your philosophy too, because I think it's important that you haven't let people influence you. You see all these people who have so many millions of followers and all these views, and it can influence the way that you act on social media, how you want to be. And so you seem very grounded. It seems like you've kept your head very level about it. You have a long-term plan, and you're not trying to rush it. Because some people try to rush it, I think, and they want to get super big quickly, and they'll do things they shouldn't do to do that.
I think it's telling too, because this is a big thing I was thinking about, and you kind of already answered it, but it's that why. And to see that you could have basically, like, once you were getting bigger, having opportunities in med school, you could have just said, I'm going to be a YouTuber, or I'm going to do just full-time video production, other stuff. You're still in residency and you're still going. And like you said, if that disappeared, you would still be doing that. And I think it can be very tempting in different stuff. And there's all these studies now about the amount of kids, young people that want to be, the top things are now YouTuber, live streamer, video games and stuff like that. And I'll talk with my friends about that. What's crazy is that, because that's what they're seeing all the time, and that's kind of like their celebrities. We're still going to need plenty of people. Like, everyone can't be this, just do this. You can have, it would work if everyone's on social media, but also doing other jobs and stuff that needs to be done. And we'll see what happens, obviously, with AI and everything else and robots. But we're still going to need people. We're going to need doctors. We're going to need nurses. We're going to need all these different types of jobs. They're all important to the world and our society. And everyone just can't be a full-time live streamer and YouTuber or social media star, I guess.
That's true. And I will say to anybody who has gotten big enough and, goes, oh, I want to leave medicine because that's like a better route. I addressed this in a video of why doctors quit, because there was a time earlier this year where a whole string of people were leaving medicine, some of who I knew personally. And to the general public, it was a surprise, but to me, it was not. But there are reasons for people leaving. I want people to be guarded in thinking that is a easier path, because being also on the other side, it is just as many hours, just as much time sacrifice as really being a doctor and resident, because you are fully self-sufficient in running your business that is almost entirely based off of your perception, which is not entirely in your control. So I figure it's a pretty risky investment to go that route.
Content creation in general, though, I don't think people realize like how much time and effort goes into content creation, from ideating, trying to make it interesting for people to watch. Like you can't just, especially educational stuff, you have to try to hook them in or describe it in a way. So just all of that stuff, editing, everything else, it's all very time consuming. And yeah, obviously then there's a lot more pressure, I think, too, if that's now your entire identity versus if you were in medicine and then doing it. And there's lots of other reasons too. I think just medicine, and the more difficult the residency and other stuff, there's going to be more people that eventually end up leaving, because it is hard. It's not, I think it can be glamorized sometimes, or just all you have to do is put in, I mean, personality wise too, like it might not be a good fit for each person and for other people. So, I mean, it's better to find that out earlier on too. I mean, there's lots of ways you could view that, I suppose.
Yeah. I just think because the whole doctors leaving medicine is kind of the trendy thing, particularly this year.
There's a mega viral one. What was it called? It's like Doobie and Gooby, the neurosurgeon who left.
Yeah.
Who actually, and he was just out in kind of the mountains. I was showing my dad that recently.
But I mean, part of the reason, I mean, for me, like what I've seen, it's so different. When I was a resident, like there was no computers. It was all paper. We wrote hand notes. Everything now it's all computer based. It's all the people you have to see. You don't have time to see patients. I think that's what wears doctors out, is just the pressure of having to produce more and more and to interact with computers. And there's so much more paperwork that goes along with stuff. And you can't just operate anymore. I did 3 surgeries today, and I spent not as much time, but I spent a lot of time doing orders and things like that. I mean, I had to do refills. My nurse called me, so I had to do refills, paperwork for the office. It's not just going in and operating. I mean, I got all this other stuff to do, and I'm preaching the choir. But what I'm saying is I think the older doctors in my age group, I mean, it's not the way we grew up. It's different. Things have changed so much, and some of these people just don't want it. Mm-hmm. Now, you're growing up in a different era, and you were brought up in all this computer stuff, and so maybe
he hates computers. If you
can, I do. I mean, I hate computers, man. So I hate computer work. I mean, I had a college student with me today, and he watched me trying to do the orders, and there were a few F-bombs coming out because I get sick of it. I mean, you hit one hard stop, and then what do I do? And my PA's not there to help me. It's like it's frustrating. I get more frustrated doing the orders than I do freaking surgery.
Yeah, I think what I will say the difference is too, from generations is, like, now we have too many options.
Yeah.
And because of that, you're allowed to make decisions without fully thinking or fully knowing what you're getting yourself into.
Yeah.
Like when you make the decision to become a neurosurgeon, you know exactly what you're getting yourself into. But now it's like, oh, you have the potential of doing this with your career, this with your career, this with your career. Or like, oh, this program is going to be easier versus this. And I think it allows you to just go with the excitement of, oh, I'm going to be a neurosurgeon, without fully doing the background reading of what does that entail? Mm-hmm. What did you just commit the next 7 years of your life to?
Yeah.
And unfortunately, people find that out the hard way, in the middle of it.
Well, how did you pick anesthesia?
Oh goodness!
Did you have a great rotation in anesthesia and you really liked it, or must be something?
It was the exact opposite, actually.
Really?
I came in wanting to do actually pediatric emergency medicine. The most amount of clinical time I've had ever was probably pediatric emergency medicine. I spent a lot of time in that ED, and to the point where, as a 4th year, even applying anesthesia, all the fellows and attendings still were trying to sway me. And I was like, I submitted my application. What do you want me to do? But I quickly found out in my 3rd year that I could not stomach the idea of doing a pediatrics or an adult emergency medicine residency first. I could not stand outpatient clinic. for pediatrics. I love the patient population. I love working with the parents, but I couldn't do that. And then up until even as much as my intern year, I don't think there is a rotation besides vascular surgery that has made me question why I'm a doctor than adult emergency medicine. Because the amount of times
I hope there's no emergency medicine people out there watching.
I'll tell them to their face. I'm on a rotation with emergency medicine residents right now, and I tell them that, where the amount of times that I've been spat at, IVs ripped out at, yelled at, walked out on, as they have ST elevations on their EKG. It's really hard to come in every day and try to help people that don't want to be helped.
True, very true.
Yeah.
And so I couldn't do that. And I discovered the OR. Really, really love the environment because it reminded me a lot of like a film set. Very organized, defined roles. And I actually was flip-flopping between orthopedics and anesthesia for a large majority of my med school. And to your point, I did an anesthesia rotation and actually hated it. It was one of the worst experiences I've ever had. I was constantly ignored, even though I told people, hey, I'm actually considering this. Treated like an IV pole in there. Never was involved. I had airways taken from me by like fresh sRNA students and EMTs, which like I know they need it, but I was a late third year med student interested in anesthesia, doing my anesthesia rotation, and I wasn't prioritized at all.
So when he's saying he had airways taken away, so you get to put the breathing tube in with the anesthesiologist there, and it's a big deal. You got to learn how to put breathing tubes in people when they're asleep. So when he's saying they probably took away your chance to put the breathing tube in, I imagine.
They did, and that's like a large part of learning experience. And I just had such an awful time there that I walked out of that rotation and then went, nope, I'm going to orthopedic surgery.
Wow.
Grinding my butt off, did sub-internship in surgery, had 3 aways lined up. I did like extra orthopedic rotations, and that in itself is a whole different story that I had to overcome and realize what I really, really liked and what I really, really wanted. And for a lot of personal and emotional reasons, I ended up leaving. And then I kind of went back to anesthesia and was like, can I still even do this? Like, I couldn't give up the OR. I really loved that place.
Yeah.
But I realized I really, 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 really liked orthopedics. I did not love it. I didn't feel the same obsession that some of my other MS4s had, where
some of your other ortho bros.
Right. Like when the interns on trauma were bragging about getting 7 hours of sleep that week, I was like, you have a 1-year-old at home. Go home and see your wife and your kid. Like, this is not something that I would be proud of bragging about, and something I never want to be proud of. And it's like, I saw that in my future. And I think a big straw for me is, and I tell this story to a lot of people, I had a pediatric orthopedic attending because I wanted to do pediatrics, worked with him, and I saw in his office a card from his kid that said, Daddy, I love you so much. I just wish you were home more.
Mm-hmm.
Wow.
And he wore it like a badge of honor.
Well, Kevin, didn't you write me one of those?
I didn't.
he didn't want me home, I guess.
Well, let's take that off air. But I saw that, and I think some people are okay with that. Some people understand that sacrifice, but me personally, that was something I never wanted to be in my future.
Yeah.
And I had to sit long and hard and go, if this is not what I want, you got to stop now before you leave as a PGY2 or PGY3. And I ended up on a whim getting a pediatric anesthesia away rotation at Texas Children's, the Baylor program in Houston. And if Texas Children's offered me a contract for fellowship tomorrow, I would sign, because that was the happiest I had ever been practicing medicine in my entire life.
Yeah.
It was exactly what I wanted to do with the patient population I knew my heart was set on with. I enjoyed every single second of it. And I was like, yeah, that was it. That was what I needed. And so I kind of came full circle that my time in surgery is very, very valuable. My time in pediatric emergency medicine was also very, very valuable. But anesthesia became this really nice middle ground of everything that I loved and everything that I wanted my career to be, while also giving me the balance that I think I needed. Anesthesia became this like oasis for me of you are welcome here.
Yeah.
And everything that you bring to the table, including the parts of you that are not medicine related or paramedicine, are also loved here. Whereas I think particularly in the surgery field, I talked about this with Dr. Rakowski, where it feels like anything that you do outside of medicine and particularly surgery, if not somehow circumferentially making you a better surgeon, the school of thought is that it is a waste of time, at least for a lot of people within the field.
Yeah.
And I have a neurosurgeon here. Please correct me if I am wrong.
Every person is different. I think when you're young, you are trying to be really good, and you spend a lot of hours because you're creating yourself, and you want to be. I mean, why do you go into neurosurgery? Because you want to be. A lot of people have the mindset they want to be the best, so that's what you're going to do. You're going to want to put in many hours as you can to be the best and be in there. And then as you mature and grow older, you realize that you don't have anything to prove to anybody anymore. You just do good surgery, and help people. So life changes. You'll see. I mean, you're just starting out. I mean, life changes as you grow older and you move through life. Your priorities will change. I thought for sure I wanted to be an academic chairman of some big academic program. That's 100% what I wanted to do. But then you start having kids and a family, and you just realize there's more to life than that. And I didn't want to spend my life in the hospital, being at meetings all the time and stuff like that. So it just changes. And everybody's different. What's good for one person is not good for the next person.
And I think kind of to that, I would love, I don't know where we are in the podcast here, but I think a nice conclusion for me would be, as someone much more advanced in their academic career, like I would love some insight and advice, or you can give some words to, the nearing PGY2 of what do I need to keep in mind as far as priorities and grounding as I go through all this.
Well, first thing, just remember this is your internship year. So they do this. I mean, I'm not sure why you do that. They just want to expose you to different parts of medicine. I mean, once you get into anesthesia, it's all different. Just like once I settled into neurosurgery, it's all different. That's going to be your specialty. So life will change drastically next year for you, because you'll be with your colleagues. You'll be doing what you're going to be trained to do, and you're going to learn all the stuff that you need to be a good anesthesiologist. So this year you just have to kind of learn, but you got to suffer through it too, right? I mean, you just have to. You have to get through it. And, like you said, don't burn any bridges. Hold your tongue. There's a lot of times that you're going to be, upset about things. You just be that guy that doesn't complain. Get the work done. Get a good reputation. Make it through the year. And then when you get into anesthesia, all your attendings are going to note that. They're going to know this is the guy. This guy works hard. He put up with a lot, and he made it through. And now, you're going to get rewarded in your anesthesia program. And then, what was your other question?
I think just general words of advice on, how to get, actually, I'm not going to say how to get through residency. That's a very commonly asked question. I think it's more along the lines of those little things of how did your priorities change and how do you keep them straight during residency?
Yeah. Well, how do you get through residency? I mean, you just have to, first of all, you have to like it. I mean, you got to love it. I loved neurosurgeon. I loved everything about it. And, we had a core group of residents. So, I hopefully have a good group of residents that you guys will become tight. That's what makes it the best, is when you have a tight group of residents and you got each other's back, and there'll be some of your longest, best memories, through residency. And, you just have to remember that these are people. Because I think a lot of people get so cocky and they think, oh my God, I'm a cool resident, and stuff. But you have to remember, these people you're operating on and that you're in there with, these people are relying on you. I mean, 100%. And the families are sitting out there relying on you. And anesthesia is not a joke, man. I can't tell you the number of times I've seen super good attendings who have so much, wealth of knowledge and so much experience. And I'll watch, sometimes they have a hard intubation and that O2 sat's going down in the 50s and people are panicking and they're getting ready to call a general surgeon to do a tracheostomy, because it's no joke. Once you paralyze the patient, you got to get that tube in somewhere. You got to get an airway. I mean, it's high stress. And, you're going to be at that point, but it just always reminds you when stuff like that happens, this is a real person with a family out there waiting, and their life is in my hands, and I have a responsibility here. So just never forget that these people are relying on you, especially anesthesia. I mean, people, for whatever reason, that's usually the most important thing I've noticed. Even being a neurosurgeon, you can be doing a brain surgery, but what they're worried about is anesthesia. They're worried about, am I going to make it through surgery, and am I going to wake up? I mean, and that's what they're worried about more than anything, more than the surgery itself. So that's a big responsibility. So just got to keep that in mind, and stay normal. Don't be mean to people. Don't talk down to people. Don't act like you're cool. Don't treat the nurses bad. The nurses are your best people in the hospital more than anybody. So make sure that I remember being an intern. I mean, I relied on nurses 100% because they knew about 1,000% more than what I knew. So don't get cocky. There's so many residents who are cocky and they think they're cool and they're going to talk down to people and they get away with it. But don't be that person. Be nice to people. Talk to everybody in the hospital. Treat the nurses well, just like you want to be treated. When you were standing there in anesthesia, they were ignoring you. Don't be that person now that ignores somebody. When somebody's in your OR, medical students there, remember how it felt, and so take the time to show them things, let them do things, whatever you're able to do and stuff like that. That'd be my advice. So just be a good person,
Absolutely. Will do. Thank you so much.
I think you got that covered based on our conversation.
No, I know.
I think
so too.
But we really appreciate having you on. It was an awesome conversation. Yeah. And I think there's definitely people who are out there who will listen or watch this and find some value in some of the different things we discussed. And I hope you have a great rest of your day off and a great rest of the week.
Thank you. Thank you both so much.
Yeah, it's great talking to you.